Are you having ongoing digestive or skin issues? Maybe you're wondering, should I go gluten-free? My name is Dr. Taranella, and in this video, we're going to look at this question, should I go gluten-free? We're going to look at some of the ways to go about it, some of the other testing you might consider, and all things related to this question, should I go gluten-free? So if you're interested in nutrition, diet, digestion, hormones, overall expanding your health awareness and getting a deeper understanding of what's going on in your body, click on the like button and don't forget to subscribe to the channel to get more videos like this one. Now for a quick disclaimer, the information in this video is for informational purposes only. It's not intended as a treatment for any health condition or as a substitute for seeing an actual doctor or medical professional. It should be used as an educational guide to deeper your understanding of your own health and treatment success. If medical attention is needed, don't delay in seeking that attention. Let's check out this topic on flatbush diabetes or ketosis-prone type 2 diabetes. All right, let's look at this question. Should I go gluten-free? So in this video, we're going to look at the question, should I go gluten-free? I think this question behind eliminating gluten from your diet is well-grounded and empirically sound, meaning in my experience, a lot of people do seem to get improvement from eliminating gluten from their diet. I encourage people to do this in specific health situations too. However, there are a few things you might want to think about with regard to this decision before you do it or even after you've done it. So the first thing to think about when you're considering should I go gluten-free is, do you have health problems, and specifically, do you have digestive health problems? If so, you might want to actually do a celiac test before you eliminate the gluten. The reason is you have to have consumed gluten enough times leading up to the test, otherwise you could get a false negative reading when you do a celiac test. Now that's for the blood test. If you're having an endoscopy, they can always do a biopsy and check for it that way too. But in the case you're doing a blood test, if you don't have any gluten close to the test, you'll get a false negative and you won't know that you have celiac. Now a lot of times once you've eliminated gluten and you realize the benefits from it, you're not really going to want to eat gluten again. So you might say, well, I don't really care. I feel better. I'm just going to stay away from it from here on out. And that's fair, but not really realistic to be 100% gluten-free. Most people are going to cheat here and there when they are gluten-free. Maybe they do it once a month. Maybe they do it twice a year, but probably is going to happen. And that will be, more critical how often you're going to do that if you know you have celiac. Not all people with celiac have really major reactions to the gluten when they eat it digestively or otherwise. But when you have that autoimmune process going on with celiac, it's basically, decreasing your absorption of nutrients because it's eating away at the finger-like projections and hair-like projections that absorb the nutrients in the food that you're eating. So the bottom line is, before you go gluten-free, you might want to get tested for celiac. Even if you don't have digestive issues, it's sometimes a good idea just to rule that out. But specifically, if you do have digestive symptoms, that would be a good idea. The next thing to think about when you're considering should I go gluten-free is you want to make sure you eliminate all forms of gluten, and you want to make sure you do it long enough to actually see a difference, meaning consecutive days in a row. So any food that has barley, wheat, or rye, or spelt is going to contain gluten. Those are the grains that have the gluten and gliadin molecule in it. Usually you want to do that for 2 weeks consecutive without any cheating at all. And during that time, you want to note how you feel with regard to digestion, mood, headaches, neurological symptoms. Could be a lot of things. If you do have health issues, you want to see if those kind of eliminate. It could be skin related too. If nothing obvious happens, then you want to challenge. And you want to challenge with that gluten for 2 or 3 meals over the next 2 days. Now, if you get an obvious response, you don't have to keep eating it. But if you don't, that's when you want to challenge again. If you don't have an obvious response from that, you may be one of the few people that actually don't have a negative reaction to gluten. The next thing you want to think about when you're considering, should I go gluten-free, is that the problems from gluten go well beyond celiac disease. So if you test negative for celiac, this doesn't mean that you won't benefit from eliminating gluten from your diet. Some have allergies to gluten, some have sensitivities to gluten, which are basically just 2 different immune responses. Other people have bacterial overgrowth or fungal overgrowth that can trigger more gas, bloating, pain, discomfort when you eat gluten. Or you may just simply have an intolerance. You can't break down the molecules as efficiently. So a good rule of thumb to go off of without doing a bunch of tests to eliminate the gluten for 2 weeks and see if the gluten reduction reduces some of your health complaints. If you do get a significant improvement, 60% or mostly improved, you might just have a problem with breaking down and digesting the gluten. It has nothing to do with the overall immune response or bacterial bacterial or any other microbial overgrowth. However, if you find that it helps, but many of the problems still persist, or you have to eliminate 4, 5, 6, or even more foods to feel normal, there may be deeper issues going on that you need to take a look at. So the bottom line with this question, should I go gluten-free, is I think it's a great experiment for everyone to do. I think it's helpful to understand how your body reacts to different foods, but it's definitely not a cure-all for everything. And sometimes there's little clues within the process of eliminating the gluten that helps you understand the deeper picture of what's going on. All right, that's all I have for this question. Should I go gluten-free? If you do have additional questions on this topic, drop it in the comment section. I may do a separate video on that topic. Thanks again for watching. We'll see you next time.